This is Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. Today we're going to talk about compromise cases or red case selection cases, or really anything some people call these surgical cases. You definitely want to look at all my other content on these topics. You can go into my YouTube channel, which is Straightsmile Solutions, look up the keyword compromise or red or anything like that, and you can listen to those videos first. This is going to be just a quick high-level overview of some of the topics I've talked about more in details. Like I have videos about compromise class 2, compromise class 3, compromise open bite, all those different things. I have an individual video that takes you into the risks of that particular type of case, diagnostic case. But today we're just going to talk about high level. Why is it so important that you do things properly when you have a compromised case? And there still seems to be taught in a lot of ortho classes. Remember, these ortho classes are not going to defend you if and when you get yourself in trouble, which will 100% happen. It's just a matter, it's not a matter of if, it's a matter of when. And by trouble, I mean whether the insurance company flags the case and doesn't pay you for it. That's the best case scenario. Worst comes to worst, you just have to pay something back. Bad scenario would be that a dental board got involved. Your license was at risk, someone's suing you, and all these different things. Now, like I said, the more ortho you do, it's happened to me. You can see my video I made about that. I did nothing wrong. It's going to happen to you. So if you're doing ortho, because if you're taking harder cases, all it takes is one complaint to a dental board, and people are much more proactive, and then they're going to audit your whole case and make sure you did things at the level of an orthodontist. And by the level of an orthodontist, I don't mean the orthodontist near you who might not be doing things right. Remember, orthodontists get a little more of a pass because they are orthodontists. That's just how it is. I'm not saying even if they don't do something correctly, that's okay, but they are trained. You are not officially trained, so you have to do everything perfect. And my job is to teach you how to do things perfect and keep you out of hot water. Now, can I promise if you work with me that's going to happen? No. You might still get yourself in hot water. So, but at least you're doing everything right and you can hopefully get out of it. So go into all those videos I made. The main thing is to make sure you're getting all the right diagnostic records at the level of an orthodontist, which may include CBCTs, perio evaluations from a periodontist. It may include CEF numbers, and knowing how to interpret those. Even if you want to make a simple case, like patient only wants front teeth straight, it does not matter. This is the most important thing that I get through the heads of my clients, is that it does not matter. Even part of the risks informed consent process is that the patient has to understand all the options before you can pick that one more limited or improved option. That is informed consent. Just like you can't, if a patient had a giant, massive hole in their tooth, you can't just say, okay, oh, you don't want, okay, you want me just to fill it. Okay, fine, but there's other options. Let me not tell you about them. No, you're gonna have to tell them about all the risks if we do that versus if we do the other options, what all the options are. Even if some are more expensive, even if you don't wanna hear it, even if you're not interested, I still have to tell you. So if you don't understand the more difficult options, whether it involves TADs, and that is not something I'm helping you with, jaw surgery, anything like that, things that an orthodontist can explain, you need to send your patient to an orthodontist to get a whole treatment plan done before you can do that improved plan. Then it's at least explained by somebody, but you can't just say they went. You have to have the documentation. You got to have that orthodontist send that report if the patient doesn't bring it back. Okay, that's the most important part. Patient signs with you, I understand that these were the options given by the orthodontist, blah, 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 blah. I've chosen to do something else. Now you have to understand what your something else, the risks of your something else is. If you're choosing not to do all the things and to do something just more limited, what are the risks if you do this? And this is where you have to really think, okay, how are we accomplishing this? Are we making the mouth smaller? Could this potentially impact my patient if I make the mouth smaller by taking out teeth or doing retractive mechanics or doing a bunch of IPR? Could this potentially damage my patient? And how do I know that it won't? Have I done an airway screening? Have I done a sleep screening? Things like that. That's going to be part of the process. I'm not sure if the orthodontist did that or not. If they didn't, you got to do it. What if you're pushing things out and forward? You're thinking, oh, I'll just expand. It's fine. Are you sure you can do that? Did you put the CBCT in the plan? Did you ask Pray if that's okay? Do you have the answer in writing? Sometimes seeing adults is 10 times harder. This is what I'm getting at. It might be 100 times harder, seeing kids and teens. Kids and teens are 1 million times easier than adults. I'm just letting you know. There's so much less headaches And that's why it always cracks me up when people are like, yeah, I'll do adults only. What? I would not want to do them at all if I had a choice. If I decided to go back to full-time practice, I would limit my practice to up to age 13. That would be, or 12, or even 10, if I could. That would be even the younger, the easier, the older, the harder. Because the bone gets harder, right? And there's less flexibility in the bone. There's less things you can do. Yes, occasionally you have growth as a surprise, but I can manage that and I can make forms for that. And if that happens, then we address it later. But these are the main things I want to let you know. So if you ever work with me on a case and I'm pushing back and saying, this can't just go to that. You got to find out about these first. You got to get the information. You don't want to take this case. It's not that I'm being mean or unfair. It's that you need to treat your case at the level of an orthodontist. And some cases need to go to ortho. That's just how it is. You can't take them all. And you're outside the scope of what you can do well. And if it's outside the scope of what you understand and what you can do well, you really have no business taking that case, even for an improved. And that's something I'll hang my hat on. All right, thanks.